Assalamualaikum warahmatullahi
Religious greetings.
wabarakatuh.
Peace be upon us all.
Selamat pagi yang
Good
di Indonesia,
morning to
selamat
those of you in
siang yang
Indonesia.
di Australia.
Good afternoon to
Salam
those of you in
sejahtera bagi
Australia.
kita semua.
And greetings to all.
Di Australia merupakan
In, this,
kebiasaan untuk
in
menunjukkan
Australia, it is
penghormatan
custom
terhadap
to
kekayaan dan
show,
warisan leluhur
to
serta
acknowledge
kontribusi dari
the
masyarakat.
contribution of the
Saya
indigenous people
menghormati
and
penghormatan
the
tersebut
ancestors and
bersama
or the guardians.
Australia-Indonesia Center.
On behalf of the Australia-Indonesian Center, I
I
would like to make
acknowledge
this
the
acknowledgement.
traditional owners of the many nations across Australia from wherever participants are joining us from today. In particular, I note the historic and long-standing relationship between the Makassans, the people of Makassar, where I am joining you from, and the Yolngu people of our East Anham land, a relationship still celebrated through the stories, arts, and songs of the Yolngu people. We pay, we pay our respect to the elder, past, present, and future. Yang kami hormati, Gubernur Provinsi Sulawesi Selatan yang
To His
diwakili
Excellency the
oleh
Governor
Menteri
of South
Kesehatan
Sulawesi,
dan Kesejahteraan Rakyat,
represented by
Sekretariat Daerah
the
Provinsi Sulawesi Selatan, Bapak
Regional
Dr.
Secretary,
Andi
Mr. Dr. Andi
Asnatohani,
Asna Tohani.
yang kami hormati, Konsulat Jenderal Indonesia di Makassar,
We'd like to
Ibu
greet
Bronwyn
the
Robbins,
Australian Consul General in
Ketua
Makassar,
Dewan
Ibu
Geoscience
Bronwyn
and Research
Robbins,
Center, Bapak Harold Mitchell,
Chair
PhD.
of the IIC Board,
Yang
Mr.
kami
Harold
hormati,
Mitchell,
Kepala Biro Pemerintahan
the
Provinsi
head
Sulawesi
of
Selatan,
the
Bapak
South
Andi Asna
Sulawesi
Sambarala. Yang kami
uh,
hormati, para
Provincial
panitia dan
Office,
narasumber Per Digital Summit
to all
yang
the
juga
speakers for
merupakan
the Pair Digital
anggota
Summit who are members
SulSel
of the
atau Senior Fellow di Australia-Indonesia Center,
Research
para
Advisory
peserta
Board
Digital Summit yang
panel,
kami muliakan.
and to all the participants in the
Selamat
Pair Digital
datang di
Summit.
Per Digital
Welcome
Summit yang keempat.
to the fourth Pair Digital Summit. This is the last
Tema
day.
topik hari ini adalah
The
kesehatan
topic
publik
today
dan
is
disabilitas
public health
anak
and
dan muda Sulawesi
disability
Selatan dalam
amongst the
konteks
young people
COVID-19.
in
Per
South Sulawesi
merupakan
in the
partnership
context of
Australia-Indonesia
COVID-19.
Research atau
PAIR
Kemitraan
is a
Indonesia-Australia,
partnership of
sebuah komunitas
Australia-Indonesian
kesehatan
research.
yang
It's an
interdisipliner
applied
yang
research which is
mencerminkan
interdisciplinary,
perkembangan dan kebutuhan atau permintaan
demand-driven,
dan
and meets the
terfokus di
needs
satu wilayah
and
saat
is
ini di
centered in a
Sulawesi
particular
Selatan.
area and currently in
Per
South
Sulawesi
Sulawesi.
Selatan
The PAIR program South Sulawesi
2019
started in
dimulai
2019 and will
beberapa tahun
continue
lalu.
for the next 2
Program tersebut
years.
didukung oleh
This
pemerintah
program is
Australia
supported by the
dan
government of
beberapa
Australia and the
universitas
government of
serta
Indonesia,
universitas
as well as
di
11
Indonesia dan
prestigious
Australia.
universities in Indonesia and
Ini
Australia.
adalah sebuah
The PAIR
ajang
Digital
untuk
Summit
menumbuhkan
is a forum
kolaborasi
which brings
tingkat
together
antara
researchers,
pemerintahan dan pembuat kebijakan di
stakeholders,
Indonesia
and
Australia
policymakers from
terkait
Indonesia and
kesehatan
Australia.
dan pengetahuan
The speakers will
kesehatan
share their knowledge and
dengan
their views
isu-isu
regarding the
berkaitan
various
dengan
key issues
pemberdayaan
related
perempuan dan inklusif
to
di
sustainable and inclusive
di
development,
Sulawesi Selatan.
specifically in
Bapak
South
Ibu dan
Sulawesi and in
saudara-saudara
Indonesia in
sekalian,
general.
mari kita
Distinguished
simak
guests,
bersama
ladies and gentlemen,
sambutan dari Gubernur Provinsi Sulawesi
let
Selatan,
us
Bapak Profesor Dr.
see and hear
Haji
the opening
Nurdin
remarks
Abdullah
from the
MAB.
governor of South Sulawesi, Professor
Dipersilakan.
Dr. Nurdin Abdullah.
Bismillahirrahmanirrahim. Assalamualaikum
Religious
warahmatullahi
greetings,
wabarakatuh.
peace be upon us all.
Selamat pagi,
Good
salam
morning,
sejahtera bagi kita
greetings,
semua. Om Swastiastu,
diverse
Namo
religious
Buddhaya, Salam
greetings,
Kebajikan.
greetings of peace and well wishes.
Executive Director of Australia-Indonesia Center, Mr. Dr. Eugene Sebastian, the Honorable Chair of EIC Board, Mr. Harold Mitchell, the Honorable Consulate General Australia in Makassar, Mrs. Bronwyn Robbins.
And of course, the representatives of the Ministry of Home Affairs of the Republic of Indonesia, the Rector or Chancellor of Hasanuddin University, and the team, officials of Makassar City, speakers for the Pair Digital Summit 2020, distinguished guests, ladies and gentlemen.
Good morning, ladies and gentlemen. I would like to express my warmest greet to all the audience and speakers. I hope this partnership will be greater and stronger, especially in South Sulawesi. I believe this partnership will bring benefit for both parties. Please allow me to continue my remarks in Bahasa. Pada kesempatan ini,
Let us take this opportunity to express our gratitude to God Almighty for our health and for the opportunity given to us, allowing us to participate in this Pair Digital Summit 2020, which is being combined with the signing of the MOU between the South Sulawesi provincial government and the Australia-Indonesia Center. On behalf of the government and the people of South Sulawesi, I wish to express my gratitude and my greatest appreciation for all the forms of cooperation established between Australia and South Sulawesi from the start of the launch of the PAIR program in South Sulawesi in November of last year until the selection of South Sulawesi as the first location for beginning the program. Naturally, I fully support the PAIR Digital Summit because research is the main foundation in the process of formulating government policy. I hope that this summit program will motivate us to continue enriching ourselves with science and knowledge in order to create brilliant innovations which will advance the nation. I wholly understand that all government policies must generate benefits and facilitate the public. Thus, relying on assumptions and feelings alone is insufficient in formulating policy. There must be research and scientific basis which supports measurable and fit-for-purpose policies. Distinguished guests, ladies and gentlemen, as a barometer in Eastern Indonesia, South Sulawesi contributes greatly to the national economic recovery. In this case, we are striving to achieve not just economic recovery, but rather quality economic recovery and growth. Therefore, I hope the PAIR research team can play a role in creating solutions, especially in overcoming the effects of the COVID-19 pandemic. As a follow-up to this hope, today, once again, we are cooperating between the government of South Sulawesi and the Australia-Indonesia Center in various areas, from improving the quality of education, health, infrastructure, agriculture, through to regional development. I hope that through this PAIR Digital Summit and the signing of this MOU, we can establish a cooperation which will generate benefits for all parties involved. Thus, the bonds of kinship between South Sulawesi and Australia will become ever stronger. That is all from me. Thank you. Religious greetings. Peace be upon us all.
Bapak Gubernur Sulawesi
Thank you to the Governor of South Sulawesi,
Selatan, Bapak Profesor Nurdin Abdullah.
Governor
Selanjutnya,
Nurdin
kami
Abdullah.
mengundang
And now we would like to invite
from the Australia-Indonesia
the
Center,
chair
Harold Mitchell,
of the AIC
untuk
board,
memberikan
Mr.
sambutan
Harold Mitchell, to give
penanda
his
tanganan.
opening remarks. The floor is yours, sir.
Thank you so much. And Parnudin, thank you so much for those remarks. I should also say we don't see enough of each other, and we look forward to be able to come back and see you again in your home. Thank you too for your friendship to all of us here in Australia. Could I acknowledge also Pa Aslan, who is with us today, the Governor's Assistant on Governance and Public Welfare, and also Bronwyn Robbins, the Australian Consul General in Makassar, for joining us. So welcome to all of you. We've had, for all of our group, and all of us are here in Australia, we've had wonderful times with you in Makassar. Today is about a very important thing. We're pleased to sign a memorandum of understanding with your region, as we describe it, a gateway to Eastern Indonesia. So important for your country, and we're delighted to be able to join with you. And it comes, as you know, following the letter of intent that we signed when we were there with the AIC board meeting. It seems so long ago. It was in December 2018, and how many different things have happened in the world since then, but we're moving on. We were at Australian-Indonesian University, and we have very fond memories of those times. But to turn to this MOU, it's important because it will deepen our cooperation with the whole of the South Sulawesi government on our flagship program, as we call it, the Australia-Indonesia Partnership, the Partnership for Australia-Indonesia Research, or PAIR as we call it. It's based on the region. And thank you for the interest, should I say, Pa Nordine, and I'm sure Pa Aslan will pass that on, for the great interest I can recall as in that signing ceremony. And it's important across 4 different areas, 4 different themes, so important to all that we're doing together. If I could just spend a moment on them. Commodities, focusing on seaweed. I recall the conversations we had, such a vital commodity to the region, affecting over 35,000 households. Transport, so critical. Investigating the impact of the new railway line connecting Makassar and Pare, which is set to transform your country and your whole region. And I recall the conversations we had there. Youth, skills and development, finding ways to empower young people's aspirations through skills and training. Youth, health and wellbeing, so important. Identifying ways to promote greater physical and mental health benefits for younger people. And I would say, since the signing of that original document, the letter of intent, it's moved on even more so that this is so critical to us all, wherever we may be able to help each other. So I say this, with this MOU, we have to explore opportunities to work together with you in delivering evidence-based research, joint policy webinars and workshops. And on that point, can I say congratulations and the great thanks that I have as chairman of the Australia-Indonesia Centre to all of the people in this last 9 months that have been able to keep the links between our 2 countries and all of our people. It's as if we are just sitting next door. We've done so. So, Governor, can I thank you for your leadership. I admire all the things that we've had in our chats that you've talked about. We look forward to continuing to work closely with you, as you well know, and your government to deliver impact to the communities. And I should say, on a personal note, we look forward to the moment when we can come back and visit you again. With that, I think I'd like to sign our part of the document. Shall I do that, Madam Compere, which I'm now holding up?
Yeah.
As you can see, and I'm holding a pen. I think we'll be pen.
Okay.
Here we go. So there we go.
Yeah.
And thank you very much.
Thank you. Terima kasih kepada Bapak Harold Mitchell, Ketua Dewan.
Thank you to Mr. Harold Mitchell, Chair of the AIC Board. Distinguished guests, ladies and gentlemen, the Australia-Indonesia Centre and the government of South Sulawesi have agreed to deepen the cooperation to advance science, technology, education, and training, marked by the agreement in the form of an MOU between the government of South Sulawesi and the Australia-Indonesia Centre, which Mr. Harold Mitchell signed. We would respectfully invite the representative of the government of South Sulawesi, the assistant governor, Mr. Andi, to sign the MOU signifying the cooperation between the government of South Sulawesi and the Australia-Indonesia Centre. Mr. Harold Mitchell has signed his side of the document. Pak Andi, go ahead, please, sir. To all the participants, I will initial this and the governor will then sign this. So this is my approval signature. I'm initialing the document and I will take it to the governor. So this is my approval signature. Thank you so much to the assistant governor And we had the head of the Bureau for South Sulawesi, Dr. Haji Ambarawa. Distinguished guests, ladies and gentlemen, if we were here in person, we would have a photo opportunity to document this moment for posterity. So everybody, if you could switch on your video or your camera, please. And I will count us down. 1. Harold, I will count us down. 1, 2, and 3. One more time, please. Thank you so much to the Assistant Governor, Mr. Harold Mitchell, Chair of the AIC Board, Ibu Bronwyn Robbins. Thank you for joining us, Bambara, and all the participants who are with us on this final day of the Digital Summit 2020. So that is the opening for the Pair Digital Summit. And now we will have our policy forum.
Panelis saya semua sudah hadir ya, Prof. Budu.
Are all my panelists here? Professor Budu.
Selamat pagi, Bu Erna. Selamat pagi.
Good morning, Ibu Erna. Pak Elan. Good morning, gentlemen. How is everybody? Is everybody healthy? Is everybody well?
Okay. Oke, Prof. Budu sudah di sini.
Professor Budu is here. Thank you again. So we'll start.
Bapak Ibu yang saya hormati,
distinguished guests, ladies and gentlemen, welcome to the Policy Forum. So our topic is public health and disability amongst the youth or the young people within the context of COVID-19. Individual health and public health is critical to growth and inclusive sustainable development. South Sulawesi as the 9th biggest economy, and its growth is higher than the national average. As with various provinces in Indonesia, 40% of the population in South Sulawesi are the young people. So there is also a high gap and a relatively high percentage of people with disability, and there is some inequity in development, and the COVID-19 pandemic will worsen this, and this includes mental health issues. So South Sulawesi has been impacted quite badly by COVID-19. I'm Nana Asnawati Saleh. I have experts who are also members of our research advisory panel. We have Dr. Ellen Satriawan. He's part of the National Poverty Alleviation Acceleration Team. Good morning, Bu Nana. We have Dr. Ellen Satriawan here. We have Dr. Erna Witular, former special ambassador for MDGs. So actually, she has a lot of titles as long as but I would just mention that she is a former ambassador to the United Nations. And Professor Budu is part of the governor's team.
Ya, Prof. Terima kasih, Prof. Ada Bapak Ishak Salim.
We have Dr. Ishak Salim. He is a founder or a foundation called Predict, which is equality for people with disability. So I would like to, I have a question for Pak Elan. The president in his second period has establish
untuk membangun
human development as a priority,
diperlukan
and to do so,
SDM yang berkualitas.
so to develop the nation, we have to have high quality human
Generasi
resources.
unggul atau generasi unggul atau
Can you talk about the issues regarding the development of young people? Bunana, ladies and gentlemen, religious greetings, peace be upon us all. If we're talking about the issues in human development, perhaps I would like to quote the release from the World Bank from 2018 regarding our human capital index. And in this release, it stated that our human capital index is about 0.53. And what does this mean? It means that babies born in Indonesia will only achieve about 50% of their entire potential. And this is because of the quality of the health, the quality of the education is not received or is not obtained. And this is supported by and this index consists of 4. There's a stunting, a length of education, and test scores and quality of learning. The most concerning is the stunting issue, because in 2018, I should say that we have made progress in the last 3 years quite well, but our final stunting figure was at 27%. For an international stat, especially for Indonesia, which is now a middle income country, that stunting figure is considered to be quite high. And if we talk about stunting, ladies and gentlemen, Ibu Nana, we're not just talking about the posture of our under 5-year-olds who are shorter than their average reference groups, but rather stunting reflects the quality of the individual, and it has a long-term effect into their adolescence and into their adulthood. Study shows that individuals that experience stunting in the first 2 years or the first 5 years of their life usually do not have highest achievement in school, lower quality employment, lower income, and this correlates to non-communicable diseases. So those who experience stunting in their infancy usually are vulnerable to non-communicable diseases such as diabetes, high blood pressure, and others. And these are the factors which impact the quality of the population in Indonesia. Thank you, Dr. Alan. So stunting is not just about posture. So this causes intergenerational poverty because they're not healthy to start with, so they cannot be fully productive. So Pak Elan, we do have face many complex challenges. I would like to hear from you about government policies to handle this issue. So if we talk about specifically about stunting, we have to realize that the stunting issue is a multi-sectoral issue, and we are trying to place emphasis and refocus in the last few years to address the stunting issue in Indonesia. Stunting used to be viewed as a health issue, but it is not merely a health issue. Stunting issue is about other factors. about awareness, about patterns of nurture. It's about environmental health, such as water, sanitation. It's about access to nutritious food. That means policies on price. It's about food availability. So that's why in the past 3 years, we are engaging all sectors to work together. And this effort to work among stakeholders, both within the government and external parties, needs to be led directly by the highest level of power in the country, the president and the vice president. We have examples with other countries who are successful in overcoming stunting. The commitment comes directly from the president or the vice president. Since 2017, thankfully, we have been able to request the commitment from the president and the vice president. And so the vice president was assigned to handle so the acceleration and overcoming stunting in Asia. Thankfully, ladies and gentlemen, the stunting that that used to be stagnant and that's 37%. That means a third of our under fives experience stunting, started dropping to 31% in 2019 to 27.7%. And because it is multi-sectoral, there must be diverse approaches. We need support for the family in the form of social protection, where we have non-cash assistance. We have a healthy golden family program, and we have to ensure the health of women and adolescents. So I would then talk about the challenges in female adolescents. This is very critical. This will determine. So once this adolescence grows up, marries, will she have healthy children? And we talk about the environment. We're talking about sanitation. We're talking about clean water, which once again is not. This is all handled by different ministries and different sectors. So once again, it is important to handle stunting issue based on a multi-sectoral approach. So you talked about women and gender. Now I would like to go to Ibu Erna. Ibu Erna was the ambassador for the MDGs, which is now the SDGs. So Pak Elan was explaining issues that are implicitly related to MDGs, SDGs, or Sustainable Development Goals. So the overall objective is to leave no one behind. So I have a question for you. How has so during the pandemic, what's your opinion on the implementation of SDGs in Indonesia, and how has it been impacted by the pandemic? Thank you. Good morning, everybody. So if we think about the logic, there are issues that would be vastly impacted by COVID-19, but because I was with Ibu Dian in Bapanas who's handling SDGs, and her presentation showed that all the goals of SDGs are being impacted by COVID. So if I may share my screen, I'll share 3 slides that are very easy to understand. May I share my screen?
Nih ya, kelihatan nggak?
Can you see my screen?
Kelihatan ya?
Belum, Bu.
Not yet. We can't see your screen yet, ma'am.
Jadi, di sana ditunjukkan bahwa di
So it shows that For goal 1, for example.
Saya ngomong aja deh, kalau memang nggak kedengaran, nggak kelihatan, nggak bisa tampil, nanti saya bisa kirim aja ke
I'll just send this
ke pair supaya bisa
to pair
diteruskan ke yang lain-lain ya.
so that it can be forwarded to those who are interested. So goal 1, so poverty is increased due to COVID, hunger. So COVID threatens food security and increase the risk of bad nutrition or malnutrition. And for health, we know that is the worst or the most badly affected, and this is tangible for all of us, and that is also reducing the social economic status, and there's an increase in medical waste, and this is badly polluting the environment, not just due to the medical waste and human consumption causing plastic, and this and there's an impact on education due to the large-scale social movement restriction, and people who are stuck at home are stressed, the parents, the mother, the father, and the children are facing lots of disruption. And so this increases the possibility of domestic violence. And we can look at goal 5.
Dampak kepada gender. Kemudian
And there's also an impact on gender with regards to energy.
Menurunnya harga bahan bakar fosil mengancam target.
And there's an impact on the reduction of the fossil fuel price. And there's a few other more that I don't think I need to discuss here. Increase in unemployment rate, drop in investment, gap due to economic shock and volatility. So essentially that SDGs across the board are at risk, and we need to work harder to achieve the SDG goals. Thank you, Ibu Erna. Now I would like to go to Professor Budu from South Sulawesi. So Dr. Elan and Ibu Erna talked about SDGs in general on the national level. As a member of the team in South Sulawesi, I'd like to speak to you. Can you talk about the development of COVID-19 in South Sulawesi? Bu Nana, to all my fellow speakers, Ibu Erna, Dr. Elan, and Pak Ishak. So I'm with the governor's team for the acceleration of development in South Sulawesi. And for some time, in addition to being focused on guiding the priority programs, the governor's priority programs in health in South Sulawesi, and during COVID-19, we have been assigned a unique and specific task. At the moment, I am a dean at the medical faculty at University of Hasanuddin. I'm also head of the COVID-19 task force, so I'm quite involved, and I understand the details regarding the activities related to the management, the prevention, and interventions for COVID-19. And thankfully, in the beginning, in April, May, COVID-19 in South Sulawesi, the reproduction rate is about four. So each person would infect maybe 4 to 5 people, so that's quite high. But as it developed up to July and August, the reproducing rate from 4 to 3 to 2, and by August, to September and going into early October, our rate is at a lower rate, so that's 0.7 and even 0.68 at one point. And it appears that in the beginning, by end of November, early December, it were going up to maybe 1, but it's a very plateau sort of wave. And by mid-December, we're hoping for this R rate to drop below 1. So that's the development of South Sulawesi, COVID-19 in South Sulawesi, and this demonstrates a very, this shows very positive results from our endeavors. And the governor and the central government are very appreciative of our innovations, our interventions thus far. So, Dr. Nana, distinguished guests, ladies and gentlemen, the reason there's been an improvement, a significant improvement, and the government of South Sulawesi was used as a role model for innovations in the management of COVID-19. And the most obvious is the innovation of concentrating. So the COVID-19, people with COVID-19s were concentrated and brought together in Makassar, because if we don't control the patients when the R rate was still at 4 and above, we were sure that the transmission would be higher, and the governor's program was quite incredible, and assigned and worked together with the hotel owners in Makassar. So the Makassar hotels were used as a place as a venue for quarantine. So we had 8 hotels. They work with the government of South Sulawesi to quarantine positive patients. So these are people who only had a fever, perhaps a cough. So they were quarantined in a hotel. And while they were at the hotel, they were quite comfortable. They were given vitamins and meals. Thank you, Professor. And we also did contact tracing. I wish to go to Pak Ishak. He's a founder of Perdik, which is fighting for the rights of people with disabilities in Asia. SDGs is very closely related to protection of the vulnerable, leave no one behind. So a vulnerable group which desperately needs attention during the pandemic, especially people with disability. How has COVID-19 impacted and increased vulnerability amongst people with disability? Thank you, Dr. Nana. Good morning to everybody. People with disability have been vulnerable prior to the pandemic. So when the pandemic occurred, that vulnerability became layered, and this is proven by research by the People with Disability Organization survey, and we're talking about the impact about themselves and their social relationships. So the large-scale social limitation measures, working from home, COVID-19 health protocols, and social protection measures, social distancing has impacted on the ability to work amongst people with disabilities, because the majority are working in the informal sector. Their need for therapy has been compromised due to these policies as well. There's no transportation, and it's not easy for them to have the assistance that they normally would. And the process of treatment is also impacted. And those who usually work in associations and children who with autistic children or Down syndrome who would get together, have their therapy and have gatherings. That could not happen during the pandemic, the communication process, and everything that is based online. And so this has been difficult. And people with disability who are pursuing their education more vulnerable when the learning tools or learning aids do not take into consideration their abilities. So the ability to handle children with disabilities, the skills that the teachers usually have to guide the children, this is not something the parents would possess. The school is not very creative in preparing the methods for learning. And how do we reduce this vulnerability? At the moment, both our friends and the government are using a twin track approach through research publication, adjusting the point of view and advocacy for regulation when people with disabilities are facing problems or facing discrimination. Perhaps this is a blessing in disguise because it is very easy to consolidate between the organizations. So we're developing alliance amongst our friends in the movement or in the community. So that might describe the vulnerability. I would like to go to Pak Elan. So you explain all the initiatives to improve many of the issues, but specifically for people with disability, what sort of social protection exists for them? Ibu Nana, ladies and gentlemen, if we are talking about support or policy that provides protection for people with disabilities, we must admit that the existing policy is far from sufficient. I'll give you an example. So within the scope of the social protection program, we have social assistance for people with severe disability. That's a program under the Ministry of Social Affairs. We've had that program for 7 to 8 years or up to 10 years. And this program provides support to those with what would be categorized as severe disabilities. And from year to year, the numbers aren't changing. Up to 2019, there are only 28,000 people in this program. But if we look at all the people in Indonesia with severe disability, we have 10 million. That's for the whole population and for the lowest 40% or only for the poor. So the program needs to be expanded, and this program needs to ensure, so that we're talking about expansion in the sense of increasing the scope of the beneficiaries and also ensuring the support. if we learn from developed countries, providing support to the people with disabilities is given in the form of cash, but it's also possible to provide this in support in other forms, assistance in transportation to basic in order to access basic services. So there's cash support. There's also in-kind support. So for these two aspects, so we're talking about scopes, the scope and benefit. I think we still have a lot of work to do. And in the president's team, we are trying to encourage the ministry and the Ministry of Finance to increase their budget, and the Ministry of Social Affairs to improve their program, and Bapanas, or the National Development Planning Agency, to include this program. And I would also like to add, if we talk about program of people with disability, we should not just rely on programs from the central government. The subnational government must have the same concern, and they have the resources through their regional government budget. They should chip in to provide the protection for people with disability, once again, in the form of cash support, especially for those who are poor, as well as in-kind support. That's it, Dr. Nana. Thank you, Pak Elan. If I can go back to Professor Budu. Professor? So we heard the explanation from, so we've heard from Dr. Isaac and Dr. Ellen about support for people with disability and other vulnerable groups. Can you talk about South Sulawesi? What is being done by the government to answer this challenge? So for the provincial government, as Pak Elan and Pak Isaac mentioned, so, we talk about the stunting program. Thankfully, in 2015, 2017, the stunting figure in South Sulawesi is relatively high, 34.5% to 35%. But by 2019, that number has dropped to 5.1%, about 5.1%. So we went from ranked 4th to 11th in the national ranking. So the governor's team prioritized stunting. The first 1,000 days of life is our focus. So we focus on newborns and also expecting mothers were given special attention with regards to improving their nutrition. So there's been a lot done for stunting, both working with the health office and also with the Department for Empowerment of Women with regards to maternal and child health. So we have a movement for a public movement for eradicating stunting. So perhaps I don't need to talk about the budget allocated by the governor for this program, but all regencies, we have 6 regencies that were the main target in handling stunting, and by 2021, there will be 6 more regencies included. So the management and overcoming the stunting numbers and malnutrition is a key program for the governor, in addition to other programs in health, such as development of regional hospitals in several regencies and areas. And finally, because maternal and child health, according to data, a lot of these issues are happening on the islands. So we have the sea ambulance and floating hospital to provide connection between the islands. So this is for handling women in labor and also managing their health. So That's it from me, Bu Nana.
Profesor Budu.
Thank you, Professor
Sebelum
Budu.
saya bertanya ke para nasabah,
Before I ask
kepada para peserta,
everybody, I would like to remind the participant, please post your questions in the Q&A.
punya waktu 8
We
menit.
still have 8 minutes.
Profesor, pertanyaan terakhir dan ini untuk
So the last question, this is for all panelists,
kita
I would like to ask.
refleksi sedikit.
So if we reflect on the complex issues, issues that require coordination, I'm sure there are programs that are actually important but may not be running well. I would like insight from our panelists regarding
yang ingin kita dorong
what should we be driving and what are the key issues and how should we be better managing them. Thank you, Nana. If we're talking about effective programs, be that for developing or increasing the quality of human capital, handling stunting, handling COVID. We need to talk about the key aspects on this. So the budget is clear. So we have sufficient budget. So I need to talk about non-budgetary aspects. So our lesson learned in assisting the government, the ministry, agencies, and the vice president this issue. Design is key. Program design is key. We're not just talking about good intentions, but we need to look at the design of the programs and the data to be able to achieve, and data regarding the beneficiaries of the program. We do need to identify the beneficiaries, and we need to ensure that the benefits of the program reaches the appropriate beneficiaries and the quality of implementation. These are the three important aspects. I do have an example. We've done monitoring and evaluation, which shows there are programs that are successful, even though there are some additional notes, such as the non-cash food allowance. So we do have direct cash transfers, and we have evaluated that the impact has been quite good on alleviating poverty. And the Family of Hope program, PKH, is also doing well. Every year, the government budgets for a program to reduce anemia. Anemia is very urgent and correlates directly with the stunting issue. This is a national program, but the last health survey showed that anemia has increased amongst expectant mothers and female adolescents, so we need to know where the problem lies. So the government needs to work with other stakeholders, including academia and NGOs, to look at the three aspects: design, data, and the beneficiary, and the quality of the implementation, so that we make sure that this all being handled optimally in order to ensure an effective program. Before I go to Ibu Erna, we did have a comment that unfortunately we don't have sign language here. So we are providing language interpretation, but we do not have sign interpretation, but this is very good input. So we have 4 minutes. What are the urgent issues right now? You're still muted, ma'am. So I do want to underline the gender issue. So in all aspects, women are the most vulnerable during COVID, whether we're talking about domestic violence and women in MSMEs,
rugi
who are
atau
directly
kerugian yang
impacted,
berkaitan dengan PHK
women who
dan
are
sebagainya.
working,
Itu juga
facing terminations.
menderita ya dari
They're
PHK.
suffering very
Namun
much.
juga
However,
saya senang bahwa
I'm
banyak
very happy
program
that there are many
yang
programs
bisa mendukung
which
perempuan untuk
are able
bangkit
to
kembali.
support women
Dari
to
Kementerian
rise
Pemberdayaan
again.
Perempuan
So from the Ministry for Women Empowerment
Perlindungan Anak
and
maupun
Protection of Children,
Women
and also with UN Women,
untuk
have
mendukung
programs
perempuan
to
di
support
UMKM
women in
di
MSMEs
sana.
to
Dan
recover.
saya juga lihat ada
And I've seen
kebutuhan
that there is
untuk
a need
dukungan
for
mengenai
support
kesehatan mental
regarding mental health,
eh, Kementerian Kesehatan
that the Ministry of Health or whoever is here can pay attention to, because mental health issues is not just for women, but also for children and for the husband or for the family. And they are very vulnerable during COVID.
mengenai kesehatan
The
mental
cases on mental health
meningkat ya. Jadi
have mental health cases have increased. So the support
dampak COVID di rumah tangga, dukungan
for the impact of COVID within the household,
usaha yang
and also support for on enterprises during COVID also is important. Professor Budo, your closing statement.
diperbaiki saat ini yang
What needs to be improved at the moment that is urgent in your opinion? So if we're looking at stunting, for example, it cannot be resolved just by focusing on the infant and the mother. This is a multi-sectoral approach. Improvement in infrastructure through to the villages is a program that is excellent for unraveling the stunting problem, because economic status would be better, and with good economic status, health will be improved as well. So with the disease such as tuberculosis and other diseases causing anemia needs to be focused on. And also we also need to focus on resolving the issue of stunting. Dr. Isak, your closing statement. For me, I think there are opportunities that we can utilize from a policy standpoint, especially for disability. I think in Indonesia, I think this is different from what Thailand was saying. We have ratified the convention. We have the laws on disability, and the organizations are encouraging the upronization of the law and the implementation laws. There's proper accommodation in education, access to accessibility and disaster services, and also access to justice. And there are 20 provinces who have regional regulation on disabilities. There are regencies and municipalities also with regulation. And in the villages, there are opportunities that are quite critical, because the inclusive village program or initiative is improving. When the government provided a social security network, many villages conducted data collection for people with disability, because the government is supporting to prioritize the village development fund. As an inclusive village, there are definitely challenges. We call it idealism. So it's a view that considers people with disability as second-class citizens. So this impacts on many issues, stigmatizing behavior and stigma in literature, stigma in many facets. but we have good opportunities with the regulation. The problem is that we still have a lot of work to do with the process variable. The bureaucratic level is an issue. The collaborative work with people with disability organization needs to continue. Distinguished guests, ladies and gentlemen, we have come to the end of our time. I would like to thank all my speakers. They are members of the Research Advisory Panel for PAIR. So I don't need to draw any conclusions. I think we have a lot of work to do. And we need coordination, a multi-stakeholder approach to coordination. And we need to touch on the more basic issues. Distinguished guests, ladies and gentlemen, our next event is the Research Forum and the Senior Fellow Researchers in Health with regard to young people, health and well-being, will explain their findings about their research in South Sulawesi and their plans for the future. And they'll be moderated by my colleague, Ibu Helen Brown. So that's the end of the policy forum today. Thank you. Religious greetings, peace be upon us all.
Hello and welcome to the Australia-Indonesia Centre and our research panel discussion to hear from the Young People Health and Wellbeing team on their research focus. Now, if you joined us earlier this week, you will have heard of the research being done into the skills and support needed so that people aged 16 to 30 can more fully benefit from the region's potential, including improvements to the seaweed industry or the benefits that the new rail line will bring. Well, today we're going to talk to the AIC senior fellows who are leading this pair research into some of the specific health challenges facing young people in this province and suggest strategies that will help policymakers. And coincidentally, but importantly, today is the International Day of People with a Disability. It's a United Nations Day observed by everyone, hopefully, which aims to increase public awareness, understanding and acceptance of people with disability and celebrate their achievements and contributions. And disability is one of the main areas of research focus for this team. So let me introduce you to our panelists and the team leaders. Professor Anu Ramahan, who is with the University of Western Australia. Welcome, Professor.
Thank you, Helen.
Dr. Sudirman Nasir, who is with Universitas Hasanuddin. Welcome, Pak Sudi.
Hi, Helen. Thank you.
And Dr. Christy Jogo Sumatono, who's with Universitas Airlangga, but currently is in the field hospital where he's been working with patients with the coronavirus. And Dr. Chris, thank you for your time and for being able to join us at a difficult time. Are you good, Dr. Chris? Can you hear me?
Thank you, Helen. Good morning.
Selamat pagi ya Pak. Terima kasih ya. Thank you. Dr. Chris, I'm going to start with you while we have you because I realize that your time is precious. Although you aren't based in South Sulawesi at the moment, you are working on the front line of the coronavirus pandemic. And part of the research is looking at the impact of COVID on young people. So your one person has a very specific and good view of how this coronavirus is affecting not just young people, but also their families and how it is affecting a region. You've been working at this field hospital in Surabaya since April, and Surabaya itself is also dealing with the pandemic. So from the work that you've done, we can learn a bit more about the broader situation. Can you perhaps start, Dr. Chris, by giving us an idea of what is happening where you're working, the number of coronavirus cases that you're seeing and what's happening at the hospital? Is it getting better or is it getting worse?
Thank you, Helen. Thank you, committee. I apologize for the star my the pair at field hospital does not interfere with the activity of the event. I happy I happy to have the opportunity to work in community service with COVID-19 until now on the 3rd December 2020, the number of the COVID-19 that we have treated the 3,820.
Chris,
Sorry,
sorry.
the voices.
Yeah, maaf mengganggu.
Until
Maybe just
height.
Pak Chris, maaf mengganggu ya, maaf. Sorry, Pak. Maybe if you could shut off your video. Just shut your video just so we can hear you. That might help.
Mungkin kalau videonya dimatikan agar kami bisa mendengar Anda dengan lebih baik.
Terima kasih ya. We will give you all the time you need, Dr.
Nanti kami
Chris.
berikan, kami meluangkan waktu untuk Anda. Pembicara mohon maaf.
The number COVID-19 patient with the treated is 3,820. People with 1,000 more male patient and 4,000 more female patient.
Okay, so it's a
1,000
very
more male patient and 4,000 more female people.
4,000 more.
2,000 more.
2,000 more. So it's still quite serious.
2,000 more male patient and 4,000 more female patient.
Right.
And we have recovered 3,616 people.
I know that you, yes, hello, Pa. I know that you don't get to leave the hospital.
Recovered 3,000. Yes. There
Sorry,
were
Pa.
no death where we work today, the treating about 200 people. COVID is indeed become a disaster. Many method and sorry.
Yes.
Yeah. COVID-19 has indeed become the world disaster. Many methods of the handling are not accurate, and the duration this condition causes the impact area to save with was provincially with the health problem impacting on economic problem and sustainability poverty. A fairly comprehensive breakthrough and the effort is needed considering that there are no drug of effort to prevent COVID-19. It seems that effort to prevent people from getting sick exposed are cheap and easy to implement, but new habit and the culture to be able to readjust the spread of COVID-19 are difficult and almost impossible to practice in the community. Once again, breakthrough effort to needed so that this research project can also have an impact to readjust and help to community so as not to contract to COVID-19 disease.
We understand.
Yep. Yes.
Terus ya, Pak.
And the theory infectious disease, there is indeed the theory to prevent people from being easily infected with COVID-19. Hierarchy control theory, where the highest peak of the hierarchy is elimination, while to lowest one is the use of self-protective tools. The hierarchy is an inverted triangle that is the getting down. The lower it is effective, yeah. Lower it is effective to be able to prevent infection as the export. But the theory cannot be applied almost all over the world because human nature and human habit are difficult is to restrain their freedom. Therefore, I try to contribute to this opportunity to be able to readjust the impact and the risk so that the risk of being infected with COVID-19 does not have to weigh the impact through a risk management approach. Risk equal human mobility times person interaction or length of the exposure to people divide by resistance or immunity time the healthy behavior of the community. The key word how to provide how to provide advice to the government and how to improve health outcome for young people, especially women and people with disability and people with poor mental health in South Sulawesi during the pandemic. 19 awareness of public responsibility must be increased by teaching young people, women as the main mover in the income overcoming health problem. Thank you. I hope the join the research program between University between Indonesia and Australia can take place and have an impact on improving the province of Sulawesi to be fun and successful.
Thank you. Thank you so much, Dr. Chris, for joining us and providing us with that insight. I understand there was a bit of confusion with the translation channels. Our apologies for that, but we will have replays available and some more information available after this session. I think what's important is that Dr. Chris is part of this leadership pair research team, and he's just given us an insight into what's happening on the front line of the coronavirus pandemic in Indonesia and why the researchers are considering this as part of the research that they're doing into youth health and well-being. It's incredibly kind of him to give us his time. He's at the hospital. I don't know a time when he's not been at the hospital helping with this effort. So if we can pick up on the picture that he's provided to us about what's happening in Indonesia, if I can go to you first, Professor Anu, can you please explain the importance of including the impact of the coronavirus pandemic in your research work? And then I'll ask Dr. Sudi the same question from his perspective.
Yeah, thanks, Helen. It's a really interesting question. As we are looking at the impacts on health of youth disability and mental health, and we're also interested in looking at food and nutrition programs, we see COVID as being a really big disruptor. So we see people that were already vulnerable to these health shocks are now finding themselves in a more difficult situation because of COVID. So for instance, people that, young people working in urban areas had to go back to their rural households, and they're facing restrictions on their ability to work. So we think that COVID is a big disruptor, and given that Indonesia is facing COVID challenges, and South Sulawesi in particular, so I think it's really important to take COVID into account. Yeah, thanks.
Thank you. And Dr. Sudi, from your perspective, how important is it to understand the impact of coronavirus in a community like the ones in South Sulawesi that you're working in?
Yeah, thank you, Helen, and also Professor Anu for providing initial comment on this. And from my point of view, I think COVID-19 reveals our multiple vulnerabilities that significantly contribute to the higher fatality rate of Indonesia compared to neighboring countries in the region. And Pak Chris briefly also mentioned some of severe clinical cases that he is treating at the moment in the hospital. And if we analyze this in a deeper level, we can connect it with several root causes, such as the problems in relation to nutrition that was emphasized in the first session, such as stunting and also people with disability. These are the root causes that multiply vulnerabilities among a particular group. And when a big shock in the form of COVID-19 come and take place, we can see both at the downstream and upstream level the factors that may contribute to our high fatality rate. That's why in our pilot project and also in our incoming program next year, we are going to try to tackle these root causes in relation to nutrition and also to health literacy, particularly among young people and more specifically to young women, in order to enable us to reduce the root causes of our higher fatality rate that we are currently seeing.
Thank you, Dr. Suri. And just following on from what you were talking about, I mean, I would like to go back to young people and some behaviors that you've seen in young people, but you've brought up now nutrition and how important that is in the early years. And if the nutrition's not received, then that puts children, as they turn into young adults, at greater risk of disease and health problems. Can you perhaps explain some of the work that you'll be doing within households to better understand some of these sort of foundation factors that lead to reduced health in later life when people become young adults, around stunting and nutrition, for instance?
Did you want me to answer that?
Yes, please.
Okay, thank you. Yeah, so that's really important, and we heard in the previous session about the importance of food security and also the importance of you know, a diversified diet to address children's nutrition. So in terms of what we're doing, there is actually very little data available on dietary diversity at the household level and the challenges that households are facing. So one of the things that we would like to do in our SIPS project is to collect a household survey data and get anthropometric measures of children and women of you know, childbearing age. And then we want to go and work with Puskesmas workers on the good diets that could be introduced in these households. Secondary data analysis is already pointing to gaps in the data that we hope our household data analysis will be able to address. And we'll also be working with key stakeholders to identify some of the challenges that households face in meeting their food security needs and the dietary diversity. And we've also done a bit of secondary data analysis looking at one of the largest social safety programs in Indonesia, which is the Raskin program, or the Rice for the Poor. And that has actually started to be replaced by a food voucher system called the BPNT. So what the BPNT is trying to do is to allow households to choose the food of their choice from e-warungs. So the advantage of this is that a household is able to choose more you know, nutritious food that they would like, rather than just the in-kind rice subsidies that they were getting. So our analysis is actually showing that households that receive the BPNT program which is targeted at the poorest 25% of all households, actually having better household dietary diversity scores. And interestingly, this program has been rolled out in Maros, but not in Pangkep and Baru. So the household survey will allow us to see how households feel about receiving in-kind food subsidies rather than the voucher, and how they perceive these different programs to be. So that's one of the things we hope to find out through this household survey. But I'll just pass it on to Sudhi for more.
Yes, thank you.
Yeah. Thanks, Helen.
Yeah, and I think also at the intervention level, after analyzing both primary and secondary data that we will obtain, one of our main goal is to provide or to strengthen nutrition literacy as well as health literacy among people in our study sites. In the previous session, both Pak Elan and Professor Budu emphasized the double or even actually triple burden of nutrition that we are currently facing in the form of stunting and adult obesity, and also deficiency in relation to micronutrient. And this multiple burden influence the high incidence or the high prevalence of non-communicable diseases at the later life, such as diabetes mellitus, cardiovascular diseases. They play an important role as comorbidity for COVID-19. So we are actually trying to address the root causes of the problem that we are currently facing, and many of the root causes are related to individual and household level of literacy in managing nutrition and health, particularly at the village level. That's why another component of our incoming project next year is also to try to seek possibilities to utilize the village fund allocations to be used in strengthening health programs at the village level, because actually village levels also have a huge potentials in many forms, including in the availability of fund. And following what Pak Elan said, what they are needed is a strengthening capacity in designing programs that address the local problems that they are facing.
Thank you, Dr. Sudhi. And just on what you've said, you know, you've already found some information just by looking at the data of some government programs, which you will dive into more. How closely are you working with different groups, stakeholders, and governments? Given that, you know, from we heard in the earlier session, there are definitely there's definitely interest in improving the health of young people. Could you perhaps give us an idea of the work that you're doing with governments, but also some other organizations? And perhaps if I can go to Sudhi first, and then back to Anu.
Yeah.
Thank you. Sorry.
Yeah, I think there are some advantages that we have since the beginning of the project, that many of the stakeholders that we are working both at the provincial and district level are the people that we already know. Such as at the current forum, we are having Professor Budu, who is both the Dean of the School of Medicine at Hasanuddin University, but at the same time also a key member of the government, particularly Governor's Development Acceleration Team. And this kind of good relationship can also be extended to the district level, both in Maros, Pangkep, Baru, and Parepare. And the fact that the current governor of South Sulawesi is also very supportive since the very beginning is a good opportunity for us. And now we also strengthen our support from the national government, such as the support from Pak Elan and his team, and also Bu Erna in linking our program more explicitly to achieving SDGs goals. I think this is a good modalities for us to strengthen the programs, both at the research level and hopefully also at the intervention level next year.
And Professor Anu, I think this is a particular area of interest for you as well.
Yes, so thanks, Helen, and thanks, Sudhi. So I was also going to add that some of the work that we're doing, in particular looking at the impacts of these programs on poverty, are something that TNP2K is also really interested in and I believe working on, and particularly evaluating the Rastra program versus the BPNT program is something that they would be really interested in, because we would be able to provide robust evidence on households' dietary diversity, and we think that also looking at the impacts on poverty is also something that TNP2K is really interested in. So I guess and also the some of the work that we're doing uses data from BPS. So we are quite interested in working with Bapenas and also the key stakeholders like Pak Isak for the disability groups. So we are really interested also in working with youth groups and women's groups and the local Bapedas as well, and Puskesmas and community workers. So, yes.
Which just reminds you about how many community groups and organisations there are working in these non-urban areas in Indonesia. I believe that Dr. Chris is still with us, which is great. We might just go to him. And Dr. Chris, thanks for staying with us.
Okay, Helen.
Thank you. We're hearing about some of the challenges facing households, and obviously young people are a part of those households. What are you seeing in terms of the impact on families and households of coronavirus?
Baik, terima kasih Helen. Mohon maaf ini posisi.
Thank you, Helen. Still at the field hospital. So what Professor Anu and Dr. Sudirman, with regards to the research plan in the future, as Pak Sudi talked about, he talked about nutrition. So the key word is what Pak Elan said earlier, is aligning the non-cash support to increase immunity through nutrition as part of preventing stunting. So this means that we must provide support at the lowest scope in the community health centers, the integrated health posts, to make sure that it's ongoing. During COVID, several activities for monitoring, evaluation of health, especially nutrition for young people, for women, and people with disability and children are interrupted because they cannot conduct these activities as usual. They cannot congregate as usual. So we do have, as Pak Elan said, we have the non-cash support being received individually by these beneficiaries. So we need to make sure that these benefits reach the proper beneficiaries to reduce poverty, to increase nutrition, and to increase immunity. And this will prevent diseases and the non-communicable diseases so that they are resilient and healthy. So that's what I'd like to add. Thank you.
Thank you. Thank you very much, Dr. Chris. And picking up on that, can I go to Professor Anu?
Boleh saya ke Professor Anu?
I'm sure that Pak Sudi can also add to this. To what
Saya yakin Dr.
extent
Sudi bisa
can you
menambah.
tell so
Excuse me?
far that the coronavirus has impacted household incomes?
Yeah, thanks, Helen. So I guess because of COVID, I haven't been able to travel to Indonesia. So the research that we've done here is basically looking at secondary data. And the BPS, which is the Indonesian Statistics Organization, they have actually conducted an online survey of about 87,000 people in Indonesia to look at attitudes towards COVID and social distancing, and also look at impacts on income and consumption. And it's really interesting that they were able to do this. I'm not aware of any such survey in any other country. But what is interesting is that we see that there has been, of course, as expected, there will be a decline in incomes, and there would be an increase in poverty. We would expect that. And this has happened mainly in the trade and service sectors, as also in Australia. But what is interesting is that South Sulawesi's income has not been as affected compared to other provinces. And we do see that there has been an increase in poverty of about 0.03 percentage points and in South Sulawesi. But what we see is, although the income has not decreased by as much as in other provinces, we have seen a decrease in expenditures and a decrease in online shopping. So those are.
Yeah, are you able to drill down the data enough to find out if that decrease is linked to buying food?
No, we are not able to. We just know that they have decreased the expenditures. It may be that they're just being more, trying to be more risk averse or don't want to spend as much because income is uncertain. But the biggest decrease is among the richest households. So it may just
be discretionary. Yeah. Very good. Thank you. That is interesting. Dr. Suri, I can hear you. Anything you'd like to add?
And I think to add to Bu Anu's explanation, we can also see some other data or other studies that conducted particularly among vulnerable group. In the previous session, my colleague, Dr. Ishak Salim mentioned about the study conducted by the consortium of organization working with disability issues in the form of rapid assessment of the impact of COVID-19 among people living with disability. And we can see from this study the significant impacts of the pandemic in multiple levels, both at economic aspect of people living with disability, particularly the significant decrease in income and of course in expenditure, but also in other areas such as psychological impacts and also health impacts. So we can also see the impact of COVID-19, both among general population and among vulnerable groups should be seriously taken into considerations. That's why we also, in our incoming program for the SIPs, we also will explore more deeply about mental health issues and also disability issues at the study sites, because the mental health aspects of the COVID-19 is very important and already emphasized in many studies, and this is not uniquely in Indonesian case, but we can find in almost all countries about the ravaging impacts of mental health related problems due to many aspects of COVID-19, and this also should be taken into account in our program in South Sulawesi.
Thank you, Dr. Suri. And one thing we haven't discussed much yet, it's been mentioned, but we'll go into it more in depth now, is the issues around mental health, which is another core area that you're looking into. Now, I'm not sure who would like to answer this, but we also have a question from the audience related to this. Eliza Hunt is asking, although there is interesting work on determinants of health and mental health, we still have not heard anything specifically related to mental health measurement. As an example, depression, anxiety, non-specific psychological distress or well-being. Are these activities going on within PAIR? Perhaps Professor Anu, if I start with you, because I know that this is one area that you have definitely been looking at, and then Professor Suri and Dr. Chris, Dr. Suri and Dr. Chris, most welcome to jump in as well. Thank you.
Yeah, thanks, Helen. Yeah, so it's quite interesting. There's actually very little data on mental health. So what we've done is we've looked at secondary data sets from the IFLS, the Indonesian Family Life Survey, and we've looked at 2007 and 2014, and we've looked at the same group of people across both years, and we've looked at whether there has been a change in mental health for these individuals. And there is a measure called CES, which is a score of mental health. So it's about, there are about 30 different components, and they give you a score, and the higher the number, the worsening the score is. And what we've observed is that among youth, actually the mental health has worsened. So between 2007 and 2014, among the same group of people, aged between 21 to 30, so these people would have been 15 to, in 2007, and now what we find is that 7 years later, their mental health has actually deteriorated. So what we did is we just did some statistical analysis looking at socioeconomic and demographic factors that might explain worsening mental health, and we did notice that it's among the youth and married women that there has been a worsening of mental health. And of course, things like poverty and disability will make people feel more that they feel like their mental health is worsening. But of course, these are measures of mental health that are self-reported, so they're not perfect. We haven't been able to get them for South Sulawesi in particular because it's a nationally representative data. There's a very small sample from South Sulawesi.
Thank you.
Yeah.
Dr. Chris, if I can go to you on this issue, because you did talk about it a little earlier about the impact on people's health and their mental health in particular. Does what you're seeing echo or mirror anything that your research, the team that you're working with, that they're finding in South Sulawesi?
Baik, terima kasih.
Thank you. Thank you, Helen. I'll just add to the findings, the secondary data that Professor Anu discussed. It is true that mental health impacts overall well-being, especially their resilience in working and their ability to generate income, their resilience in social relationships. And the cases that I found in COVID is related to mental health, where the stigma, so once a person is accused of having COVID, this will impact on a drop in immunity, their resilience, and their ability to survive. So clinically, this is a burden, and this puts them eventually on a ventilator. So what we hope, as Professor Budu said earlier, that coordination in the field is separating them in a certain place, so for example, in the field hospital, and having a mental, the speaker apologizes. I believe we've lost audio.
He looks busy, doesn't he?
Just one moment, there was some background noise. So once again, to be honest, we have to see, as what Professor Anu has said, this will impact on the overall health. This impacts their ability to be resilient in fighting COVID. So that's all I would like to add. To be quite candid, this is the key issue. In addition to increasing their immunity, it's making sure that they are happy. So we provide therapy. We're not giving them antibiotics, antivirus. We're trying to make them happy, bring them joy, and to boost their immunity. And then they can recover and fight against the other non-communicable diseases as mentioned before. Thank you.
Thank you, Dr. Chris. We are short on time, so I'm perplexed as to what question to ask next. It's such a complex area, but so many important threads to it. I think just finally, what I might do is that it's been mentioned a few times, the difficulty of being on the ground to ask questions and get information with coronavirus. And of course, that's something that you're looking to work with, and hopefully in the future we'll be able to get out more. But Dr. Sudi, if I can just check with you, and then Professor Anu, it's a question from the floor about methods. How are the instruments, what are the instruments that you're using to assess dietary needs of the households and the limitations and challenges in the Indonesian context? You had mentioned this, but I guess there is interest in how you're going to dig deeper and bring communities on board to what you would like to get from them, because that, I imagine, would be quite difficult. Professor Anu.
Yeah, thanks. So maybe I'll answer this and then pass on to Sudi to talk about the community groups. So with regards to the instruments, so in the household survey, we are going to ask households to report their self-report on their food security status, like did they go, if any member of the household went to bed hungry and so on. So what are their coping mechanisms if they are food insecure? We'll also get measures of dietary diversity, the different food groups that they consumed in the last 24 hours and also the last week. So we get measures of household dietary diversity, and then we get measures of food insecurity. These are self-reported. Additionally, we would just get height and weight measures for children under 5 and their mothers, to get their BMI, and anthropometric measures to measure stunting using Z-scores for height for age. Yeah.
Thank you. And Dr. Sudi, last word to you. If you have a minute to give us your
and
answer.
I think also to improve the reliability or the validity of our approach, we are going to employ a mixed method approach, both utilizing quantitative survey, but also a significant part of our project, both in nutrition aspect and also in mental health aspect, will also use a qualitative approach, such as to explore their coping strategies, their barriers, and as well as facilitators in facing challenges related to nutrition and mental health aspect of their life. And to add to that, we also work with local stakeholders, including in the primary healthcare level, who deal with these issues on daily basis, as well as to the non-government organizations working in this aspect, so we can provide a strong triangulations to obtain relatively comprehensive data to better understand the problem. Of course, this is not going to be perfect, but we try to strengthen the validity through these multiple methods and multiple resource.
Thank you. Thank you very much, Dr. Sudi. And that's where we'll have to leave it, I'm afraid. Unfortunately, we didn't get to ask as many questions as possible about disability, but to let you know that the team has found that there is not as great an understanding of the different kinds of disability that exist amongst young people and some of the supports that they need, and that will also be a part of their research. And I'm sure we can learn more if we keep track of them, as we will do. I would very much like to thank our panel speakers for today, Professor Anu Ramahan from the University of Western Australia, Dr. Sudirman Nasir from the Universitas Hasanuddin. Thank you. Thank you, Anu. And Dr. Kristojogo Sumatono from Universitas Airlangga, currently at the Field Hospital in Surabaya. Terima kasih banyak ya. Thank you very much, everyone, for your time and your insights. It's been most valuable. All, of course, are senior fellows with the Australia-Indonesia Centre. Now, to wrap today's panel session and the last session for the PAIR Summit, which will become an annual event, it's my great pleasure to invite Alistair Cox, the Deputy Head of Mission at the Australian Embassy in Jakarta, to deliver some closing remarks. Thank you very much, Pak Alistair.
Well, thank you very much, Helen, and terima kasih sekali dan selamat pagi.
Thank you very much. Good morning, religious greetings, peace be upon us all, and greetings to everyone.
To be here today on behalf of Gary Quinlan, our ambassador, who unfortunately is sick today. But I'm here in Chargé d'Affaires of the embassy here in Jakarta, and I'm very happy to be able to come in on this closing session to congratulate all the participants and thank you for your participation in this 2020 digital summit to talk about your research agendas, particularly with respect to youth, health, well-being, also the disability, and also the link to infrastructure and development. And I'd like to thank very much, Professor Nordin Abdullah, the Governor of South Sulawesi, who has been participating, I think, in some of the earlier sessions, and also to our good friends such as Dr. Elan Setriawan of TMP Duakar, who's a very strong collaborator on social protection, and also to former Minister Ibu Anna Witala, who's another very good friend of the embassy and a great champion of the MDGs, and a great champion for all things multilateral here in Indonesia, and many other participants beside, and all of the participants from Australian universities, including obviously led by Monash University, Melbourne University, and University of Western Australia, just participating there, and many others. University of Queensland and University of Melbourne. So thank you very much for all of you and all of the Indonesian participants from Universitas Indonesia, Gajah Mada, Bandung Institute of Technology, IPB up at Bogor, Institute of Technology, 10 November, Airlangga, and Hasanuddin University, of course, there in Makassar. So thank you very much for everybody participating, and I think we're so fortunate in this era now that with virtual communications, we can conduct a sophisticated summit and exchange of views using this technology. I think if this pandemic had hit even 10 years ago, we would have been in quite a lot of strife because we wouldn't have had such advanced technology, and I think that we've learned a lot from that. I wanted to say that the work you're doing on practical research orientated around the themes of the Partnership for Australian-Indonesian Research, which is orientated around research around the circumstances of South Sulawesi, is a very important model and case study. And I also wanted to thank, of course, Dr. Eugene Sebastian, who is the director of the Australia-Indonesia Centre at Monash, who has worked with us on from the beginning on the design of the partnership, and now we're seeing the partnership being implemented and the partners beginning to work on their research designs and beginning to plan for the rollout and implementation of their researchers. And you know, with the development of infrastructure in South Sulawesi and South Sulawesi's rapid development, the new railway line between Makassar and Pare, for example, and the potential for development along the railway corridor, but also some of the challenges, environmental, perhaps changes of employment patterns, both for good but also challenges. I think there's definitely a need for strong evidence-based policy, and we're very fortunate, I think, to have a figure like Professor Nordin as the governor of South Sulawesi, because you know, as a Bupati before in the province, who raised up a very poor kabupaten to higher levels of income through evidence-based approaches and championing evidence. That's a very important model. So we really do hope that this work in pair can be a great model for Indonesia and even other countries about the importance of evidence-based, data-driven policy making, not just something based on the whims of politicians or the whims of influential business people, but based on genuine policy, what works, what is based on the real facts on the ground. And the importance of that, I think, is being demonstrated more than ever by the COVID-19 pandemic. Unfortunately, the pandemic has demonstrated that there's an enormous challenge still ahead on evidence-based policy making. As we've seen in the United States, which one would have hoped was the leading country for science and technology and evidence. Even there, if evidence and science is not translated into policy, the outcome is chaotic. And so, and there are many other countries, I'm afraid, where we've seen that happen as well. And there are countries, you know, equally where we've seen it work well. You know, you think of Taiwan, or you think of New Zealand, or you think of Germany, or you think of or Singapore. You know, there are countries where leaders have taken the lessons of evidence and have used them effectively. They learned things from the last epidemics of H1N1 or MERS or SARS, and then they were well prepared for COVID, whereas others just were all over the place. So I think it underlines that evidence-based policy is critical, but you've got to early on, and this is where I think researchers need to think hard, and where, of course, the fortunate thing about South Sulawesi is that we have a leader like Professor Nordin, but we need to connect the researchers to the policymakers early on. So I want to encourage all of you researchers in your different research teams working on different aspects of PAIR, from the health sector to the infrastructure sector and the youth sector and all these subsectors, to work together to figure out who your key decision makers are, who the key interests are. Sometimes they'll be influential business people or influential local decision makers, maybe parties or local dinas heads or people in Makassar, in the provincial capital, or other politicians, and engage them in your networks from the very early stages, so they are enthused, interested, and engaged, and they are stakeholders from the very beginning. Because otherwise, as we've seen, we can produce a lot of terrific evidence, but if politicians and key interests are not engaged, then a lot of this excellent work just goes to waste. So I think it's vitally important, particularly in South Sulawesi, with such strong intellectual as well as political leadership now, to grab the moment and to make this experiment work as a demonstration for other parts of Indonesia and other countries, other middle-income developing countries. I think at the Australian government, the Australian Embassy, we've been investing in knowledge to policy work for some time through our so-called knowledge sector initiative, as well as PAIR, this program, but also in other programs as well, like the UN Pulse Lab and the JPAL, which is part of this Harvard program that won the Nobel Prize last year. So these programs for a middle-income country like Indonesia are critical now, but the battle is being waged now. The battle between populist nonsense and rubbish being promoted by unscrupulous politicians and people who just want your votes versus people who are trying to bring about good outcomes based on evidence and bringing everybody together. So I know many of you researchers and academics probably want to go, oh, I don't want anything to do with politics. But the reality is that if you want your research to be meaningful, then you have to. And you have to join, you have to make allies and build allegiances. And, you have to engage in the mess of policy and politics, which has become so much more difficult really in a way also because of social media and which has just allowed 1,000 ridiculous voices to bloom alongside the intelligent voices. So if I could call on you in your summitry now and next year to make sure that you move quickly from research design and implementation of research and getting good outcomes to link to policymakers, to how these ideas will be extended and how these ideas can be used to improve the livelihoods of people in this case in South Sulawesi. But I think if it's successful, it's a great model for the whole of Indonesia and other countries like Indonesia around the world. So dengan ini, terima kasih sekali atas kesempatan hadir pada.
With that, thank you for the opportunity. Congratulations, and I wish you success for the researchers from Australia and Indonesia. under the umbrella of PAIR. And I hope that you have a happy end of year. It's a little bit difficult to COVID-19, but hopefully 2021, the coming 2021, will be a better year than this year.
Thank you again. Assalamualaikum warahmatullahi wabarakatuh. And good morning. Thank you.
Lovely. Thank you, Alistair Cox, the Deputy Head of Mission for the Australian Embassy in Jakarta. We appreciate those closing remarks and your time today to finish off the first of our PAIR annual summit. As you know, the Partnership for Australia-Indonesia Research is working in the province of South Sulawesi to investigate and make findings over key elements to its future and development. We've touched on the role of the seaweed industry in improving farm productivity and community incomes. We've looked at the potential positive benefits of a railway line. And we're also diving deeply into young people, their needs and aspirations, health and well-being, and how that ties into their family environment and their career opportunities. So I hope all these conversations over the past 2 weeks have provided not only some insight into the work being done by the PAIR team, but also how this kind of research can potentially have an impact on policy and also issues that affect a wider region than the province. The webinars are available as a full replay online, and we'll have today's up by tomorrow. And we'll also have them available as single sessions in the future for easier viewing. And if you've opted to receive updates from the Australia-Indonesia Centre, we will definitely let you know when those are available and how you can access them. I'm Helen Brown. It's been an absolute pleasure to be with you during this time. As I said, if you'd like any more information, get in touch with us. There is a link in the chat button for you, or the chat room, I should say, there where you can get in touch. There's also in the chat a link that you can click on to catch up with the short films in Real Oz Ind, our online short film festival and competition. That's been extended for your viewing pleasure. It's open still for a few days to see what some directors from Indonesia and Australia have come up with, this time over the theme of energy. It's a fantastic competition. Please jump on and have a look if you can. And again, thank you kindly for your time, for your participation. We wish you all the very best, and please stay safe.